This week we are going to look at direct care activities in person-centred care. Meet Tom. Tom is a 49-year-old man who has just been told his pancreatic cancer has returned and metastasised to his lungs, liver and spine. He struggled with previous chemotherapy and is tired. How can person-centred care help Tom get the care that he needs and wants? But first of all, what is person-centred care? Person-centred care is about focusing on the person and not just their disease. It emphasises looking at the person as an individual, respecting their rights and beliefs, as well as focusing on the development of therapeutic relationships by building trust and understanding. It responds to the perspectives and the needs of the person and their family and supports them in making decisions regarding their care. Around the world, many healthcare systems are adopting a person-centred care approach. As research shows, improving people's experience and involvement in the healthcare environment can also improve health outcomes for many people and therefore be more cost efficient for the healthcare system. Person-centred care processes. Person-centred care involves these 5 main care processes: working with patients' beliefs and values, engaging authentically, shared decision-making, having a sympathetic presence, and providing holistic care. Let's look at working with patients' beliefs and values. We should start by looking at what our own beliefs and values are before caring for others. This can help one develop the ability to relate to people from diverse backgrounds. By looking at an individual's beliefs and values, one can gain a better understanding of the person and what is important to them and their family in order to be able to create a more personalised plan of care. Person-centred care endeavours to assist an individual in maintaining their beliefs, values and traditions in the healthcare system by being respectful to their needs and individualising care activities.
Following the person-centred care process, it is important to understand that each individual section needs to be combined to better the patient's experience and outcomes. One of the contributing factors of person-centred care is engagement. The purpose of engagement is to include and involve the patient and their families to engage within the care given to the patient. This is an important part of person-centred care, as patient engagement empowers patients and loved ones to become more active in their own care, as it focuses specifically on what the patient wants and makes them feel valued. As a nurse, our role is to create a rapport with a patient and their families. This will build trust, creating an environment where the patient feels comfortable to engage in treatment plans. Engaging with the patient and providing accurate information about their care allows them to make an informed decision about their treatment, including discharge plans. By engaging with the patient and allowing them to be involved in their own care encourages patients to follow through treatment, leading to best possible outcomes.
The next pedal in the person-centred care model is shared decision-making. This topic is closely linked with the other areas of the model to work successfully to provide the best care for patients. The key focus of decision-making is working with the patient to participate in the decision-making process by ensuring the patient receives all relevant information. During the process, the patient's individual beliefs and values are taken into account. The patient can be involved in the process of decision-making as much or as little as they desire by gauging the level of participation the patient wishes to have in their care, whilst ensuring that informed consent is achieved. The use of skills to achieve the goal, whether it's clinical, shared, or patient-led. And it's important to develop a clear picture of what the patient values about his or her life to make sense of what is happening with them. The next pedal in the person-centred care model is shared decision-making.
Having a sympathetic presence is another aspect which delivers a person-centered care framework. The benefits of having a sympathetic presence helps to develop a high-quality connection with the patient. Patients may be extremely vulnerable and anxious about the medical procedure they are having. By understanding patients' emotional states, it helps to develop trust between a client and healthcare worker in order to meet the patient's satisfaction. This trust and confidence in medical staff is essential for a patient's mental well-being. The major features of sympathetic presence require strong and active listening skills and perceptive support. Patients need to know that they are being treated as a person, and this can be achieved by explaining procedures to them, listening proactively, and paying attention to what they are saying and helping them understand what treatments are happening. Nurses have many responsibilities in the healthcare environment, and if they are not careful, they may feel under pressure, and this can be damaging to the nurse-patient relationship, as it is essential for nurses to give each patient their full attention. It is also important to involve the patient's family members, as they have an important role in supporting the patient. They can be involved in this by communicating more about the feelings and well-being of the patient. The personal knowledge of family members can also help to solve problems and create better outcomes for continuous patient care.
Providing holistic care. Holistic healthcare is the heart of nursing care. It is a complete patient care that considers patients' needs, including physical needs, emotional needs, social needs, economical needs, and spiritual needs. The goal of holistic care. Holistic care can maximize the patient's physical symptoms, for example, pain, short of breath, and fatigue. It also can maximize the patient's psychological symptoms, such as stress, anxiety, and alterations. Holistic care can build a trustworthy relationship between patients and nurses, and finally, to improve patient satisfaction and promote better health outcomes. To develop and deliver holistic care, it is important to understand patients' needs, wishes, especially the patient's background behind their disease.
Leadership challenges around person-centered care involve cultural differences, personal values and beliefs, and the ability for cohesion, potential language barriers, ways to communicate around this, equality among team members, does everyone feel included, and what kind of work culture do you want to be a part of?
Although quality is often defined as providing the right care at the right time in the right way, through adopting patient-centered care approach, the definition of quality shifts to providing the care to fulfill the patient's needs in the manner and the time the patient requests. The main priority for both patients and healthcare workers are positive health outcomes. Elements of either definition should be implemented to ensure quality and informed healthcare. The University of Montreal introduced a scheme to include patients to develop enhanced healthcare services. Teams of patients and doctors designed training for medical students and research innovative ways for providing patient-centered care. Those patients who were involved in the project stated that they felt like they were making a difference. The University of Washington Medical Center collaborated with patients and their families to redesign the too often ignored procedure of bedside handover. The UWMC discovered some nurses completely ignored the practice while some adhered inconsistently. The UWMC states that the goal was to standardize the process and support nurses in overcoming barriers to its inconsistent use. The redesign consisted of developing a standard and structure for the bedside handover, identifying and addressing pre-existing barriers to its use, and the introduction of tools and materials to handle issues nurses had encountered previously. Following the implementation of the redesign, patients and their families reported high levels of satisfaction and improved levels of communication between themselves and staff, and especially noted an appreciation for the introduction of new staff members taking over the shift. These innovations, led by nurses and other healthcare professionals, exceeded in achieving patient-centered care and in turn reached their main priority of positive health outcomes.
So how can we use this for Tom's situation? Firstly, we need to look at Tom the person. Tom was born in Vietnam and arrived in Australia when he was 13. He worked for many years in the railway. Tom has 2 teenage daughters and is a devout Buddhist. He was diagnosed 5 years ago with pancreatic cancer and was very sick throughout his chemotherapy. So what does Tom want? After engaging with Tom, we find out he doesn't want any further treatment. He's exhausted and doesn't want to prolong the inevitable. He feels comfortable talking about this as his nurse has a sympathetic presence. The nurses inform the doctors, who discuss this with him and involve him in shared decision making. Tom deteriorates and is admitted to the palliative care ward, where the nurses discuss his beliefs and values and what Buddhist traditions he would like to follow as he approaches end of life. The nurses involve his family as much as possible in his cares and provide support and comfort, offering a holistic aspect of care to Tom and his family. Tom passes away peacefully a few days later, with family all around him. Following Buddhist tradition, the nurses organise for his body not to be touched for 8 hours after passing and provide a quiet room for the monks to chant while he was passing and 8 hours afterwards. As nurses, it's important to see our patients as individuals. By working with patients' beliefs and values, engaging authentically, involving them with shared decision-making, having a sympathetic presence, and providing holistic care, we can work towards improving person-centered outcomes in the healthcare environment. Person-centered care can help develop better therapeutic relationships between healthcare workers and their patients, as well as assisting individuals to get the care they want and need.